Hey, this is Dr. Drew, and today I want to talk to you about one of the most common reasons people seek medical care. It's for low back pain, and it's so poorly treated in our system that the most people are given is painkiller, time off work, maybe a bit of physical therapy, and they're also told to stop doing the things they love to do. So it's not a very good approach. There's a good chance out there that everybody watching at some point will experience low back pain. So I'm going to take you through top to bottom approach of what we do to get people better. All the day-to-day stuff we need to do becomes very hard, difficult, and frustrating when we're dealing with chronic back pain. And then the depression and anxiety kicks in, and it can really spiral out of control. And this has led to the painkiller and opioid crisis and all the addictions because people have not been shown a way out of this. They get caught in it and they never get out. So let's break the cycle with this top-down approach. So we need to find the pain generator. And what I mean by that is there's only so many tissues in the body that generate pain signals. So if you just go through the list when you're assessing low back pain, you can actually find a lot of interesting things. So is it a ligament? Is it a tendon? Is it a nerve? Is it a bone? And so you're just kind of going through this Rolodex in your mind as a practitioner when someone presents with low back pain. What's firing up their pain signal and what tissue is that's involved? Now, by the time people get to me, I'm usually like fourth, fifth in line because they've tried chiro, physio, massage, and various other treatments, osteopath, acupuncture, and then they arrive in my office and they go, "What else do you got, doc?" So by then they've probably had a lot of muscle work, whether it's massage or physio, muscle, maybe trying to give them some rehab and strengthening exercises, but the pain still returns. Or maybe they've had chiropractic adjustments where the spinal joints have been mobilized because they were restricted or fixated, and that has provided, again, some temporary relief, but they still don't have long-lasting relief. And make no mistake, those are all really good treatments, but again, if people don't get full healing, they'll keep looking. So by the time they get into my office, I'm kind of going, what else hasn't been considered? I'll check the muscles out, I'll look at the spine and see if there's any joint fixations or restrictions that remain, but then I'm looking at the nerves. I'm also really curious about the ligaments, and the most important ligamentous structures of the lower spine that often get overlooked are the iliolumbar ligaments. So there's two big ligaments that bolster your spine to your pelvis. They come off L4 and L5 and they attach to your pelvis. These are chronically injured and sprained during lifting and twisting motions. And when those ligaments are sprained or partially torn, they send out tremendous pain signals and it causes weakness of all the surrounding muscles. What also happens is when you damage and sprain ligaments, because they're supposed to support your lower spine, your muscles now pull double time. So instead of just moving you, your muscles also spasm and tighten up in order to stabilize your lower spine because those ligaments are no longer adding stability. So I'll assess the iliolumbar ligaments, and if they're found to be lax or unstable, you can inject them with a solution known as prolotherapy or PRP and get them to tighten back up and heal so that they can go back to doing their job of stabilizing the lower spine. The second most important ligaments are the sacroiliac ligaments, the anterior and posterior ligaments of the SI joint. If those are damaged or laxed or sprained and you have SI joint dysfunction, it can mimic things like sciatica, which is pain into the buttock, down the side of the thigh, or to the knee or further. And the keynotes for this is I get adjusted all the time, and then before I get home, it's out again. Or I'll get my SI joint worked on, and within a few days, it's back to where it was. That is a keynote that there's instability in that joint that needs to be treated with some potential injection therapies in order to tighten it up. Other ligaments that can be damaged with the lifting and twisting and injuries, car accidents, sports injuries can also cause this to the back, are the interspinous and the supraspinous ligaments. Those are smaller ones that kind of knit the vertebra of the low back together, so those need to be checked as well. And then the nerves, let's talk about. So the most common one people know about is the sciatic nerve, and maybe a disc herniation involved with it, where you have that jelly donut that is a disc pushing on a nerve and causing pain down one side or the other, commonly known as sciatica, where there's pain felt anywhere along the sciatic nerve. Now, I want to start by saying that disc herniations are never a death sentence. They can usually be treated with conservative care, and it's not always like, oh my God, am I going to need surgery? In vast majority of cases, the answer is no. If it's a really bad disc or a large central or an extremely progressed one, you might have to have a surgical consult, but I want you to think that probably 80% of them, very likely, you can treat them conservatively. What does conservative care look like? It looks very similar to all those things I just mentioned. Chiro, physio, massage, and if that gets it, great. Then you don't have to step up and add anything else. The keynote is this: if you get a massage and all those muscles are relaxed and they feel good for a day or two, but then they just come roaring back and they're in spasm and pain, they're actually stabilizing your back, and that's not treating the cause, it's just treating the symptom, which is muscle spasms due to ligament laxity. So you got to fix the ligament laxity, and then the muscle spasms will take care of themselves. Doing too much muscle release in those cases can be problematic because it may set you up for further injury. So just a little side note. Since we're talking about disc herniations as well, traction therapy and anything you can do to pull it apart and allow that jelly to reabsorb in the donut is a good idea. Traction tables as well as Y straps to sort of take the kinks out of the spine, and then make sure you're well hydrated because those discs have a lot of fluid, and if you don't have fluid coming in, they will be dry and they're much more susceptible to injury. So get your water in. I probably say this in every video, but 1 liter per 50 pounds body weight each day combined with salt and electrolytes is super important to make sure the discs are hydrated. There always has to be some form of movement therapy as well when it comes to back pain, because usually a lot of back injuries are due to poor movement mechanics. What do I mean by that? I mean not lifting properly, not bracing properly. And the keynote is when you're lifting heavy stuff and awkward objects, you have to keep the load underneath your nose and between your toes. If you break either one of those, you put your spine at risk, because if it's not between your toes, you're twisted. And if it's not under your nose, you're probably reaching. So now the moment arm is way more because it's further from your spine. So that load puts a lot more force through your lower spine, and you can shred those ligaments or the disc very easily. And the thing with backs is they need the right amount of movement, not too much, not too little. If you're dealing with back pain, the worst thing you can do is just lay around all day expecting it to heal. You need to get it moving. That pumps fluid circulation and blood flow into the area, and that's really the only way you're going to heal back pain. Also, when we move and lift and exercise, because a lot of these injuries can happen in the gym, you need to make sure you're not in anterior or posterior pelvic tilt. And what I mean by that is if you pretend your pelvis top part here is like a bucket of water, you don't want to be spilling water out the front or out the back. So you need to make sure that the pelvis is centrated directly below the rib cages. Rib cages are not flaring up or down, and everything in the midsection and core is neutral when you lift, so that the spine is getting equal pressure on the front and back. Core stability is another big one. This entire area around your midsection and torso is known as your core. It's not just your back, it's not just your abs, it's the collection of all of them working together. Core strength and stability is really important for backs. Endurance specifically, yes, you want a strong core, but you also want one that can endure. So that's where the endurance comes in. And so I like planks and side planks where you're stationary, holding a nice braced core. For front planks, you want to shoot for at least a 90-second hold. And then for side planks on each side, you need to be going for at least 75 seconds. This gets you to a point where there's enough endurance in the core to actually stabilize the spine with movements. Some other things with back pain that I find people will attempt, and it makes things worse, is foam rolling the lower spine and using lacrosse balls or really intense objects to dig into the muscles and beat the heck out of them. You can foam roll above where all the ribs are. You can definitely foam roll and strip out the gluteals, the hip flexors, the hamstrings, the quads, all that's fine. But the muscles of the lower spine themselves, I wouldn't beat to death, and I certainly wouldn't foam roll and aggressively release them. Also, smoking. Smoking decreases blood flow to all the small vessels of the spine, so it's almost impossible to fix chronic back pain if you're a chronic smoker. So if there was ever a reason to stop, that is the one. There are some of my colleagues that will not even treat the spines of people with ligament laxity if they're chronic smokers, because they know they're not going to heal and have good blood flow there. Spinal hygiene is another big one. You have to look at things you're doing day to day that may be causing problems. And the analogy we use is pretend the spine's like a credit card. And you know what happens if you flex and extend and bend that credit card enough times? Eventually, it wears down and it snaps. You can look at your spine similarly, where you only want to use those flexion and extension cycles for things you really need to do. So for example, instead of sitting in a chair and leaning over to tie your shoe, why not bring your shoe up to you, and then we can bend forward with a little bit better position in our backs. Something as simple as that, because we do tie our shoes and bend over many times during the week. So if we can add up all those flexion extension cycles and get them into a safer, better position, such as putting your foot on a stool or something and bringing it up to you, that can really cut down on spinal wear and tear. And then other things like hinging over and brushing at the sink instead of just doing that freely, you could put one hand on the table, because this is one of the most common areas where people will actually throw their back out, as they'll say, I was brushing my teeth and I hinged over the sink and boom, there it went. So offloading by stabilizing with a hand. And again, just learning how to move better. Lots of walking, because that gyration of the SI joint and hips is really good at pumping fluids in and around the lower spine. And then just getting strong. Most chronic back pain cases, with all the passive treatments in the world, will not reach 100% until the person adds a bit of strength training. So get your spine strong. I don't want you to be afraid of squats and deadlifts. Those can be definitely back breakers if they're done wrong, and certainly can't be done too early in the rehab process, but use them as tools and the variations of them under the guidance of a good strength coach in order to rehab your spine, because those are the best ways to actually build a bulletproof core and low back. So get the help of someone that can help you incorporate them safely so that you're moving and doing them properly. And so if you found this helpful, or you know someone that's dealing with low back pain, please share it. Please let them know about this. If you have questions, want to know more, or need my help, just drop a comment below. And as always, thank you for watching.